Challenge soon, convincing Americans to get booster shots. Top health officials in the Biden administration could recommend an extra dose as early as tomorrow, when we expect President Biden to talk about the issue at the White House. The booster would come 8 months after getting the second shot of either the Pfizer or Moderna vaccine. The move is driven by both the Delta variant and initial evidence that the vaccine's protection starts to drop within months. Boosters are already recommended for the immunocompromised. If expanded, healthcare workers and older people could be among the first to get them. So what would a booster shot mean for you and the fight to keep the coronavirus variants from spreading? We put that question to Wish TV medical expert and former Surgeon General Dr. Jerome Adams, and Dr. Adams tells us the move is based on what doctors have learned from vaccine studies in Israel.
The vaccine was still effective against preventing severe disease and hospitalization and death, but there was still spread going on. There were breakthrough infections that were causing spread, and they gave over 1 million people there a third dose and saw significantly increased immunity, antibody levels after that third dose was administered. So really what they're doing is following the science here. And the science says you're still protected from hospitalization and death. But if we want to break the chain of spread, then it's important that we start getting people these third booster doses.
Dr. Adams went on to tell us that the U.S. could begin giving booster shots in late September or early October. He also expects those who were first to get the vaccine, including medical professionals and those in nursing homes, would be the first to get the booster shot.